Good afternoon, everyone. It's 101 Central Time. This is a call for emergency preparedness support for home care and hospices throughout Louisiana and Mississippi. I welcome you to today's discussion. We're going to be focused in on Metro New Orleans, which is Region 1, the South Shore, and Region 9, the North Shore of Lake Pontchartrain. It involves Orleans, Jefferson, St. Bernard, Plaquemines, Livingston, Washington, St. Tammany, St. Helena, and Tangipahoa parishes. And I thank all of you for being on today's call. Um, Before we get underway with that, I just want to remind everyone that these sessions are being recorded. And if you're in a different region, you can always refer back to those regional recordings so that you can share that information with your staff. Today's session is being recorded, so at the end of today's session, we will have this available to all of the providers in region, all of the providers who have patients in regions 1 and 9. Just to give a sort of a big picture, I pulled some data for us to put this all into perspective. Between the North and the South Shore, we're talking about 1.4 million people living in that area. And between the two, Metro New Orleans, we have about 300,000 Medicare recipients. So folks over the age of 65 that we are concerned about. With regards, we see that about 15,000 deaths in this area every year, just normal deaths. When we're talking about home health, and hospice, we're looking at about almost 8,000 people being on hospice in a given year in this area of Louisiana. And each year we have about 3,000 deaths on the South Shore, and another 2,600 on the South Shore. So that means that every day there are 8 deaths on the South Shore, 7 deaths on the North Shore, 15 deaths every day, let alone during hurricane, during emergency declaration we're dealing with. And if we're talking about in terms of numbers of folks involved on hospice, we're looking at about 8,000 on hospice. Remember, when we're talking about home health, we're talking about 3 times that number. So we're talking about 25,000 home health patients, as well as 8,000 hospice patients in this given area. So we're talking about a lot of folks. And I think that it's real important that agencies remember the sheer numbers of people that we're talking about in an actual emergency. Um, so I pulled the at-risk registry reports for last Friday, and I was happy to say that we had all of the patients, just about all the patients, had been updated last week. Out of those 8,000 people, out of those 30,000 people that are either on hospice or home care, on the South Shore, 257 were reported as of last Friday needing assistance in the event of an evacuation order for their neighborhood. Another 233 on the North Shore. So again, we're talking about almost 500 people that would need assistance on any given day if there was some sort of emergency declaration. And agencies, again, we want to try and get these numbers as low as possible so as to uh, not burden the emergency resources that are available. So again, hospices, home health, your job is to try and find alternatives to having patients rely upon the state or the parish to move them in an actual emergency. If you can find family members, if you can find friends, if you can find church groups, if you can find civic organizations to help with those particular patients, take care of those patients, that would in, relieve the burden of this of these 500 patients that would need assistance in the event of an actual emergency. So we're talking about some big numbers in Metro New Orleans. In terms of the folks that are involved in helping home health and hospices with those patients. I am the designated regional coordinator for home health and hospice in this part of the state, but we also have Javon and Tom, Meredith in New Orleans, Sarah and Gillian in Jefferson Parish, Keith on the North Shore, and Colin Simino in St. Tammany Parish, who are all on today's call and will be part of today's discussion. So I want to thank all of them for being part of today's discussion. So this is for the provider community. These are your contact folks. You please go through me, but these are the folks that we will be dealing with in terms of Region 1 and 9. I also put in Region 3 because I know a lot of folks who are servicing a lot of home health and hospices that are in Region 1 also service Region 3. So these are the main regional contacts for our for ESF 8. Every week we send out those reports to the emergency managers. And last week, Region 1 did a fantastic job in terms of updating all of those patients. It's really important that you continue to do that throughout the entire hurricane season so that emergency managers have these actual numbers when they are making plans, especially as we go into the peak of hurricane season toward August and September. In the registry, I do want to point out in region 3 patients in Region 1 and 1 patient in Region 9 is currently missing a parish assignment. While the information on the patients are there, they're still missing the assignment of the parish. So I need you to go in there and make sure that you're listing the correct parish. All of the patients in Region 1 and 9 have zip codes, so that's a great thing. And I just want to remind everyone that in terms of the date of birth field, it's written in terms of the year first, followed by the month, followed by the day. There's been some confusion about that. I just want to make sure people all understand that. We have an incredible instrument in terms of the at-risk registry for communicating all of these 500 patients to the emergency managers, as I said, across the 9 parishes here. In terms of this is the breakout per parish. Any questions? And I see Leo just joined us. Leo, thank you again. Leo is responsible for creating the at-risk registry for us some 18 years ago, I think now. It was right after Katrina that we started working on this device for home care and hospice patients. We send out a report. We send out a reminder every Thursday. If you're not receiving that reminder to do the update on Thursday for the at-risk registry, please let me know, and I'll be more than happy to include you in that weekly reminder. These are some resources for agencies to use with your patients in terms of helping them get prepared for this hurricane season. And I know Keith Peak is on today's call. He's in Region 9. And tomorrow, Keith, you have a Healthcare Coalition virtual meeting, correct?
That's
At 10
correct.
o'clock?
Yes, sir.
And this is the link for anybody who has patients in Region 9, which is the North Shore of Lake Pontchartrain. Please uh, click on to that and be part of this healthcare coalition meeting on the North Shore if you have patients in that area. Uh, Final thing I want to say right now is that on next Wednesday, we will be looking at the Mississippi Harrison County, which is Gulfport. So, having said that, I know Meredith is in somewhat of a time crunch, right, Meredith? Meredith, are you all with us in New Orleans? Is there anyone from the New Orleans region in Orleans Parish on today's call that wants to begin our discussion? Okay,
Hey,
Gilliam?
oh,
Yeah,
hey,
who's that?
Jamie. Sorry,
Meredith,
one second.
there you are. Good, thank you. Meredith,
Hey,
do you have slides that you want to?
I'm actually on my phone, so I don't know if you have the slides that I sent you earlier today, and if not, I can just talk through them, and then you can send them out afterwards if that works too.
Yeah, I didn't set them up, but go ahead. Why don't you take us through that discussion, and then I'll include those slides in what I send out to everybody.
Okay,
So,
perfect.
so Meredith is with Orleans Parish. Meredith, you want to go ahead
Sure.
and just?
Yes.
Hmm?
Sure. Hey, everyone. So great to be with you today. My name is Meredith McInturf. I'm the manager of the Public Health Emergencies and Environmental Health Unit at the New Orleans Health Department. And so our team, works really closely with our New Orleans Office of Homeland Security and Emergency Preparedness to make sure that we have emergency plans that address the needs of folks with medical needs in our community. And so one of the ways that we go about doing that is, through these kind of preparedness talks and things like that. And so just making sure that you all know how to get in touch with us is a big part of that. So I always encourage people to have our PHEEH email at NOLA.gov. And you'll get that on the slides from Jamie, but that email address goes to our whole team so that we're able to effectively answer your question, whether that is something about daily operations or if that is something about an emergency related issue or something related to a local ordinance. It really helps our team to have it there. So I always encourage people to reach out to that email first, and then we can kind of assign it from there. Besides that, there are also some great ways to get in touch with the New Orleans Office of Homeland Security and Emergency Preparedness, most notably by signing up through the NOLA Ready text alert system. So you can do that by texting NOLA Ready one word to 77295. And from there, you can also decide if you want those alerts in English or in Spanish. You can also directly sign up for those Spanish text alerts by texting ESP to 77295. And that is a really effective way to get that information, both to your providers that are operating in Orleans Parish, but also to families of patients and clients. We also have Smart 911, which is the same system we have been using for about the last 3 or 4 years. And that is also connected through our emergency alert system. So when you text NOLA Ready to 77295 or ESP to 77295, it will send back a link to smartphones to either complete a Smart 911 profile there, or you can go to NOLA.gov/Smart 911 to fill out additional information about a household, which can include everything from multiple members living in the household, pets, folks with medical needs, potential types of emergency transportation that might be needed, and more. So this is a really effective way for us to kind of do some planning with our numbers of how many people we have in the parish that might need support. I will say specifically for home health and hospice, we do rely really heavily on the at-risk registry for those numbers as well, because we know it gives us some of the better numbers, just knowing that your providers are actually going into a home and assessing care levels that are needed pretty regularly. So please also continue to fill out that. We do use that and receive it weekly from Jamie. And that helps us with kind of all hazards response, whether that is, anything from a widespread power outage to a hurricane or anything in between. That is one of the most helpful tools that we have. The other thing that Jamie asked me to go over is reentry placards. And so we do have those as well for our parish, and also can issue regional reentry placards. So that system has changed a little bit since previous years. So if your group does not already have those for Orleans, you can go to onestopapp.nola.gov, and that's also in that PowerPoint presentation. And you'll click on the apply button, and then it's under business resident or business reentry requirements or something like that. But it's all on that PowerPoint. So once you receive that, that's the way to access reentry placards for the parish. Other than that, some of the things I think to also mention, we want to hear from you all. So if there are issues that you're encountering during an event, sometimes it is hard to kind of get in touch with everyone all at once, but we do have a QR code on our slides as well that has a link that you can include contact information of folks from your organization that you want notified from NOHD during an emergency. So if that has changed, or even just updating it again this year would be great. There is a QR code in my slides that has that way to update your contact information for us. But I think that's all I've got for me. Jamie, is there anything I missed?
One question in terms of the reentry placards, those placards are for home health and hospices agencies that are actually located in Orleans Parish, correct?
Correct. Yes.
So yeah, you have to apply for the placard in the parish in which your office is located, not your patients, right?
Well, it could be both, I suppose, but generally speaking, that's one of the reasons that I think home health and hospice specifically would want a regional reentry placard.
Right.
But yes, generally, I would say apply within the parish that your home office is in.
Right. If you get an Orleans placard, that's going to be for the entire region,
Sure.
including St. Tammany Parish still.
I believe that they do honor it. I'll have to double check exactly,
Well,
but
I see Keith Peak is on today's call as well, so we'll ask him about that.
Perfect.
Okay. Sticking on the let's stick on the South Shore just for a second. Gilliam, I think you're going to be speaking on behalf of Jefferson Parish today. Is that correct?
Yes. Hi.
Yes.
I am Jillian, and you don't know that only because we've never met.
Right.
So hi everyone. I'm Jillian Addison. I am Sarah Babcock's new emergency management public health coordinator. So I'm embedded in EOC over here, and what I'll do, I also have slides. I didn't.
Okay, I will stop sharing mine and let you share your slides. How about that?
Yep.
Very good. And Gillian, while you're doing that, again, agencies that are actually located in Jefferson Parish should apply for placards through your agency.
Yeah,
correct?
yes, and I will show you how to do that.
Okay. Because I think most of the addresses for home health and hospices are actually located in Jefferson Parish. So.
Okay. Am I allowed yet? Nope, it says someone else is sharing.
I stopped sharing.
Really? Let me see.
You should have, you have permission.
Okay, I still see your screen. Let's see. Maybe it's just does everybody still see Jamie's screen? Or is it just my Zoom?
Yeah, I still see it.
You still see my screen?
Well, I see
I'm sorry.
Now we just see you. That's awesome.
I'm sorry. I thought I clicked the right button. There's so many buttons to try and remember in life, and I didn't click the right one to free the screen. Now it's yours.
Yes, all good. There we go. Okay, so similar to what Meredith said, obviously we really appreciate you guys including us and sharing with us everything that you do. And we all want to obviously make life easier on everybody's clients here and patients. So in Jefferson Parish, what you see here is a picture of our website, and to get notices, they text JP Alert or JP Notice See Us to 888-777. But then down here in the blue area, you'll notice that there is medical needs registry and re-entry placards. And when you click the re-entry placard, it takes you to what you see here on this site. The actual website is linked here as well. That'll take you directly there. And then you click on the button to get started, and it takes you into making an account and putting in what your business is and what your work is. And that is how you get your re-entry placard for us. And then to the immediate left was the medical special needs registry, which folks can register themselves for. A caregiver can register a patient, or a neighbor can register a neighbor. They can also call here. So that is how to do that directly. And then our local shelters support post-storm if homes are damaged or widespread power outages happen. What's really important is that we can support, to know for y'all's cases, are we can really only support folks with limited medical care and who can sleep on a cot. So that may mean some of the folks need to be going to a hospital, that kind of a thing, or family members making sure they get evacuated pre-storm for that matter. So our oxygen distribution sites are located, one on the East Bank and one on the West Bank. Fire Station 81 in Harvey and Fire Station 20 in Metairie. And then when we do
let me just ask you one question.
Yeah.
In terms of sheltering, you're talking about shelters are only going to be open post-storm. Jefferson Parish doesn't have any plans for pre-storm sheltering, medical sheltering, huh?
Not medical sheltering. Okay. No, there's still some things in the works for a potential site that would be
okay
for last resort, but that would really be people who don't even need to be on cots. We really all feel like folks are going to die in their homes, and we need to make sure that doesn't happen because it's been the storm too, intensified too quickly or something of that nature.
Okay.
So this is what would happen when we get an evacuation order. And then we do have parish assisted evacuation. So that's for anybody who doesn't have their own means of transportation, and they can bring one bag per person. Now that we do sometimes before a storm, if we have enough time. So
when we're talking about large numbers like 125 hospice and home health patients that would need assistance, it's really important that agencies prepare their patients and families. If they're going to be transported, they need to go when the transport actually arrives. And I know in the past we've had family members or patients who are saying, I don't want to go to the shelter right now. Right now is whenever the parish says that they're going to be transporting you. That's when they need to go. They don't tell the parish. The parish is going to tell them if they're relying upon the parish or the region to move them.
And it is actually really important to note that in the past few years, all of our storms that became Category 3 or above were either not even considered a category yet, or were Category 1, and then within an overnight period intensified rapidly. And that's where we run into trouble now. So that is something really important. You're right. I am going to skip the next two slides, which just go through the timeline so that you guys can have but it's in here, so I'll send this to you. But so you can have our information, because something I noticed on what you had in the first slide, Jamie, had Sarah's information. I think it was at .net maybe. So we just want to make sure everybody knows it's jeffersonparish.gov for both of us.
I'm sorry, .gov. Okay.
That's totally fine. And well, you just would want Sarah to be able to get the email. So we want, and we do too. So these two phone numbers, the EOC number is the direct line for anything. And then my line is the 1818 number. And I can take calls for people to register them in the medical needs assisted evacuation list if they don't have a computer or if they're unable to. However, in terms of your patients, we really want to make sure that we're doing the best of service to them and their families. And we wouldn't want to, I'm just being completely honest, we don't want to take somebody who's like really in their last 24 hours of life or something along those lines, because we're not going to be able to help them and keep the family together. So we just want to be wise that, there's obviously on a continuum of care in getting home health all the way to the very end of hospice. So, use this wisely with your patients that you're serving, please. And I think that's all I have. Yeah.
And if you send me your slides, I'll include those in the package I'm going to send out to everybody for Region 1. Before we move to the North Shore, I see Tom. Tom is our regional coordinator for Region 1. Tom, do you have any comments that you want to
Sure.
make with regards to Region 1?
Yeah, I'll just chat a little bit about our role. Keith is in a similar thing over in Region 9. Giovanna and myself, we are the designated regional coordinators for the Healthcare Coalition in Region 1. We sort of coordinate all the Tier 1 and Tier 2 hospitals and hopefully assist them as needed. We work closely with Jamie also when he has any problems, so we work very collaboratively together. We also have the ear of the state and the federal partners that can come in and assist. So we have sort of a fairly large coordinating problems and solutions for that, but we're here to help, and I'm sure Jamie will throw us a problem if we need to help them with something. That's all I really have.
Yeah. Well, one of the big things that Tom and Siobhan help us with, or when we have, especially hospice patients who are going into an active phase of dying right as the storm starts approaching, rather than trying to get them into a medical need shelter in Baton Rouge or Alexandria, we've been very successful in getting them admitted into a hospital here in the region for the duration of the storm and their active dying process. So I really appreciate the work that they've been doing with hospitals to allow that to happen, so that patients that fragile won't expire on the road to a shelter.
Yeah, we try to keep our eyes on that too, and especially in the outerlying St. Bernard and Plaquemine parishes. I live out in St. Bernard at the ends of the earth, so I understand sort of the rural segment that way. And Giovanna and I work whenever we can to place them in our local Tier 1 hospitals. So anytime, Jamie.
Thank you for your service. Anybody else on the South Shore in terms of emergency management that would like to say something before we move to the North Shore?
Hey Jamie, it's Nina Kandongo with LDH here in Region 1. Liz is not going to be able to be on the call, or she might join a little bit later, but just wanted to introduce ourselves. I'm Nina Kandongo. I'm the Louisiana Department of Health for Region 1 Emergency Preparedness Planner. I'm a small team under with Liz Belcher, who is our Public Health Coordinator. And then on the call also we have our newly hospital nurse coordinator, David Zaccardi. So we are under ESF 8. We report to Bureau of Community Preparedness. We differentiate from like health standard with the Louisiana Department of Health. We are just in Region 1 when we deal with emergency preparedness to the Region 1 parishes. So Jefferson, Plaquemine, St. Bernard, and Orleans. During hurricane activation, we're usually at, again, depending on the scenario and all that, but we're usually at Orleans Parish EOC. So that's, and we can, we didn't get you a slide. So, but if we, get information, I'll send that out to you. See if you want to send that to everybody. So they can get a hold of us that way.
You and David, I don't think are receiving the regional reports for one, since you all are new to Region 1, but I'll be more than happy to get those reports sent directly to you all each week. It's a regional view of home health and hospice patients that would need assistance. Just send me an email address, and we can include both of you in those regional reports.
Sounds good. Thank you.
Thank you. Okay, anybody else on the South Shore before we move north? Okay, well, we're going to move across the causeway to St. Tammany Parish, and Keith Peak, thank you for being with us today as well. Keith, I'll open it up to you.
Yes, sir. Well, first of all, thank you, Jamie, for the invite, and thank you for what you do. And you know, we claim you as a home health hospice DRC, so thank you for that. You do great work, and I also want to thank the hospice and home health agencies. Thank you for what you do. I know it's enormous from day to day. Then, of course, when you add a disaster emergency, that burden increases. So, thank you. Coming from healthcare, of course, my wife was a former nurse, so there again, thank you very much. With that being said, I just want to kind of remind the home health and hospice agencies that in Region 9, we really don't have a pre-storm shelter. Now, we do have a medical special needs shelter at Southeastern in Hammond. That is state ran, state supported. But there again, it's going to take a lot of circumstances to open that up. And when it does open up, more than likely it's going to be post-storm. So just to be mindful of that. Now, with that being said, their again is set up to receive 100 patients with 100 caregivers. But so one of the criteria that you have to have is you have to have a caregiver to be able to enter into that particular medical special needs shelter. There again, it's going to be post-storm, and there again, there's a lot of things going to have to happen for that trigger to be pulled to open up that shelter. But there again, as we normally say from year to year, just please remind your folks, and I know y'all do a great job as far as make sure they have all the oxygen and extra oxygen that they may need with their DME companies, and also the dialysis, whatever need they may have for dialysis. And there again, I know Network 13 does a great job with their patients. And so anyway, just be kind of mindful about the oxygen and dialysis needs. And I know Collins is going to back me up on this, but anyway, just as also a reminder, and Jamie, you had mentioned about it, is when the parish tells you to evacuate, that's your timeline. That's your decision point. Be mindful. If you ever hear a rumor about contraflow, be mindful. Tell your patients and their family members you want to leave the North Shore before contraflow starts. Because once contraflow starts, you are going to be extremely limited on where to go and what exit to get off. And there again, you're going to be stuck in traffic for hours. And there again, as we know, especially if you're a hospice patient or a home health patient, you're going to start decompensating. So it's other words, you have the lack of exits to get off of. You can have the lack of the availability of gas. You can have the lack of availability for restrooms. So anyway, just be kind of mindful. Hey, if you ever hear a rumor about contraflow, leave before contraflow starts. There again, also with that medical special needs shelter, there's going to be a triage line, and there again, we're gonna broadcast that out to Jamie and of course the coalition, that triage line when they do open up that shelter. But be mindful there again, they're only going to allow 100 patients with 100 caregivers. So that's going to be a very limited resource. There again, our hospitals normally decompress, you know what I mean, pre-storm. So be mindful, and especially particularly in Region 9, as of today, not that things can't change, but as of today, our hospitals are not shelters. So we don't shelter patients. And as of today, I have nobody that has raised up their hand to accept respite care. You know what I mean? For hospice respite care. Now that may change. We're going to have a meeting tomorrow, as Jamie had mentioned. I'm going to bring that up again. We've been talking about for years. But anyway, at this point in time, we don't have any hospitals that does hospice respite care. So anyway, be mindful. There again, our hospitals are going to decompress, and our hospitals do not accept shelterees. With that being said, Jamie, the numbers that you had mentioned in the beginning of this call is just astounding. It's astonishing. Goodness. so goodness, thank you for what you and all the agencies do for those folks. And also, and just like anything else, I know certain times, like today, we may mention the limitations. But I will personally and professionally tell you, when we get those onesies and twosies that fall out of those guidelines, I would do what I can personally. I would do what I can professionally, and I will also do what I can as far as a church member to provide care for that patient. So call me, and there again, I will see what we could do to try to take care of that patient because we always have those onesies and twosies, you know what I mean, that happen. Unfortunately, the family doesn't plan well, or things just doesn't work out like that they had expected to work out, whether it be personally or whether it be the care team or whether it be whatever parish they may live in. So with that being said Jamie, I'm going to turn it over to Collins.
Before you turn it over to Colin, let me question one. Region 1, I see a little note here that the placards are good from Region 1 for 2 years. They say 2024, 2025. So if you got a placard last year in Region 1, it's going to be good for this year. Is the Region 1 placard acceptable in Region 9? Or
Well, they're
in St. Tammany Parish?
okay, they're game for healthcare workers.
Uh-huh.
There is no placard required in Region 9 for healthcare workers. So that's really not an issue
Okay, great.
on the North Shore. There's no placards needed. All you need to do is have some type of official ID.
Visual ID. So your staff should make sure that they're wearing their ID when they're moving around Region 9, as well as in Region 1. But in Region 1, you need a placard. Okay, thank you, Keith.
Yes, sir.
I appreciate your work in trying to help us with those patients on the North Shore. Colin, you want to jump in here?
Sure. First, let me say that our director, Clint Ori, apologizes that he couldn't be on the call. But of course, I'm happy to fill in. Clint personally takes the at-risk registry and goes through it every week. He's a former 30-year fire chief with Mandeville Fire and also a paramedic. So he takes a particular interest in this. And we appreciate everything that everyone does. Everyone on this call in creating that at-risk registry. It is a valuable tool for us to know what it is that potentially we have to work with in terms of our at-risk population. But one thing Clint did ask me to emphasize is the importance of the accuracy and completeness of the information. We want to do the best we can with this. Clint takes it and personally goes through and sorts the information. On the last week's report we actually had 2 people that weren't in St. Tammany Parish. One was in Hammond and one was in Orleans. We had 42 people without any indication of whether they had pets or not. There were 2 with transport left blank, type of transport needed. So just as an example, we have 39 who indicate they would need ambulance transport. Of those 39, 6 have pets, which we are prepared to work with. We will have our animal services coordinate to meet at the person's home and pick up the pet if they need to be transported. But there were 14 we don't have any indication of whether they have a pet or not. So it's that kind of information, if we know in advance, when the time comes, it's just going to make our triaging and transport work a lot smoother. Jamie, as you began this presentation, I appreciated a lot of your comments about each individual trying their best to have their own plan, that they do not rely on the parish. We have 127 this week, and like I said, 39 requiring ambulance transport, 21 requiring paratransport, and 65 by any transport means. We work with our Council on Aging, St. Tammany, and we have a transportation coordinator, and we are going to do our best to transport who is in need of transportation. And as Keith said, you know, you have the onesies and twosies who show up, and we will do our best to accommodate as we can. But as someone else previously mentioned, you know, nowadays with these storms, they tend to pop up quickly and become very intense very quickly. So in the limited time frame that we might have available, we're going to do the best we can to prioritize and move those in need, and hopefully catch everyone we need to. But again, having all that information as complete and accurate as possible really helps us out. Clint, we send that list once he's done a QC of all the data. We send it to our GIS department and they map it. And that also goes to our animal services folks, to our transportation coordinator. So we all every week are on the same page about who out there potentially would need transportation. So I think that pretty much covers it. Keith, have I left anything out? And again, I just want to emphasize that we greatly appreciate all the work that everyone on this call does to accommodate and to help us be prepared to take care of our at-risk population. The numbers you showed, Jamie, they are kind of, mind-blowing in terms of all the people out there who potentially might need assistance. And the work that everyone does towards that end, we appreciate. So I think that's about all I've got.
Yeah, and that's why I want to remind all of the providers: make sure you're not making promises that somebody's going to come and pick folks up to transport them out of harm's way in the event of a hurricane. You can see we're talking about 500 people that you've identified through the at-risk registry that would need assistance, and we don't have resources in the metropolitan area between the South and the North Shore to move 500 people at any one given time. So make sure that your patients know that we send this information, but it doesn't mean that their transportation is going to be guaranteed, because in an emergency, all bets are off. You know, this is for planning purposes only. So, do we have anybody else on the North Shore who wants to speak before we open it up for any questions? Okay. Leo Radassa with Mums that continues to maintain the at-risk registry is on the line. Leo, you hear how your tool's being used and the importance of that tool, correct? Thank you for your service in terms of maintaining it. We appreciate that.
Thank you, Jamie. Yeah, and by the way, I'm here more so we're gonna look to make improvements. I wanna hear the feedback and what we can do to make the program better for you guys. Yeah, the work y'all do is terrific.
Thank you. I want to turn to the provider community now, home health and hospice agencies. Do you have any questions of anything that you've heard today from emergency managers in Region 1 or Region 9? While we're waiting for any questions, in terms of sheltering on Region 1, again, those are all going to be post-storm medical need shelters, if be correct, Tom? There are no plans for a pre-storm medical shelter, correct?
Hey, Jamie, this is Liz in Region 1. Sorry
Thank you,
for
Liz.
joining late. Yes, any medical sheltering that occurs in Region 1 is going to be post-storm.
And if we need to move patients before the storm out of harm's way, and they're not actively dying, that probably they will end up either in Baton Rouge or Alexandria, where the nearest medical shelters will be, right?
That is, out of all of the shelter locations in the state, those are the two most likely locations to open. But again, it would depend on path of a storm, and just capacity.
And that's why it's important that agencies remind their patients, their families, that they need to make their own plan. They will be brought to a shelter that is going to be far away from their homes, and if they are with their friends and their families and their neighbors, they're going to be a lot more comfortable than in a state-run shelter.
Yeah. Jamie, may I add to that?
Yes.
Just for awareness now, the plan is to, the mega shelter in Region 6 in Alexandria will be the first one to open up. They will only open up the Region 2 PMAX shelter if it's needed. So just as a FYI,
I see.
they'll be going to Alexandria first.
Right.
Until there's a need to open up the Region 2 Baton Rouge PMAX Center.
Thank you. Thank you for making that distinction. Yeah. So your patients need to know these details, and you don't make any promises to them about that transportation, because like I said, with 500 folks saying they need assistance in getting out of the area, it's those resources are going to be very thin in an actual emergency. And people will only be moved if there's a mandatory evacuation order called for the region. It's not simply because a patient wants to get, doesn't feel comfortable in their home that they want to go somewhere else. This is only if there's a mandatory evacuation, which I guess brings me to both, do Region 1 and Region 2, we have a policy of sheltering in place for category 1s and 2s, 3s as well. Do we have any clarification on when mandatory evacuations will be called for areas, or is it just by area every storm is going to be different? Would they ever call an evacuation order for a category 1 storm?
Hey, Jamie, it's Liz.
Yes, ma'am.
Everything is going to be kind of situationally dependent on a storm. There's no hard and fast, at this category, there's a mandatory evacuation. I don't foresee a category 1 for having an evacuation order that's mandatory. But if we were to get, like a very slow moving rainmaker, strong category 2, there's no telling what local leaders might make that decision as far as evacuation goes.
Thank you. Any other comments or any questions from the provider community? Anything keeping you up at night with regards to your patients and the families that you're caring for?
Jamie, the only thing I would add as far as like you talking about mandatory evacuations, just for awareness, if we get a category 4 or 5, I would go ahead and start thinking they're going to initiate contraflow. So they're going to be mindful of that. And on the North Shore, of course, we're talking about 30 hours out from landfall, which is the H hour, which is GOSEP, the governor's office sets that time. That they're the one that starts that clock. So just be mindful, particularly if it's a category 4 or 5. Just remember, you want to leave, you want to get out of St. Anna Pass, you want to head north or east or west way before 30 hours before landfall.
If we have that sort of warning, because we've seen these rapid intensification of storms that have been less than 30 hours before landfall.
absolutely right. We're talking about a normal developing storm. You're absolutely, if we get one of those fast developing storms right there in the Gulf, uh, more likely you're gonna have to be looking at sheltering in place.
Okay. Any other comments or questions for our emergency managers in Region 1 or 9? Okay, well, I think I'm hoping that we are prepared. We prepare for the worst and hope for the best. This hurricane season, we were spared last year pretty much, and I'm hoping that trend's going to continue. So we don't have to test any of these systems, but we are going to be prepared as much as we can, and I appreciate everyone's attention today. If you'd be so kind as to send me all of your slides, I'll put them into one package and then send them out to all of the participants today so that people can draw down this information and share it with the rest of their staff. Okay. Any final comments before we close out today? Okay, we're hearing those. Thank you so much for your attention, and we'll see you all next week when we will be looking at Harrison County in Mississippi. Thank you.
Thank you, Jamie.